Can antibiotics lower PSA levels? Have you ever wondered if antibiotics can actually affect prostate-specific antigen levels? Prostate-specific antigen, or PSA, is a protein made by the prostate gland. Doctors often measure PSA levels to screen for prostate cancer and other prostate issues. Elevated PSA levels can suggest several conditions including prostate cancer, benign prostatic hyperplasia, or prostatitis, which is inflammation of the prostate. Now, antibiotics are medications used primarily to treat bacterial infections. One specific scenario where antibiotics may help is in cases of bacterial prostatitis. When this condition causes inflammation of the prostate, it can lead to increased PSA levels. By treating the bacterial infection with antibiotics, the inflammation may decrease, potentially lowering the PSA levels. However, it is crucial to note that antibiotics will only lower PSA levels if the elevation is due to a bacterial infection or inflammation. If the elevated PSA is caused by prostate cancer or other non-bacterial conditions, antibiotics will not have any effect. In fact, PSA levels can sometimes be high even in aggressive prostate cancer, and benign conditions can also cause elevated levels. Using antibiotics without clear evidence of an infection to try to lower PSA levels is not recommended. This practice can delay the diagnosis and treatment of more serious conditions, such as prostate cancer. Medical guidelines suggest that routine antibiotic treatment solely to reduce PSA levels is not appropriate unless there is clinical evidence of infection. If PSA levels remain elevated after antibiotic treatment, further evaluation is necessary. This may include imaging studies or a biopsy to rule out prostate cancer. In summary, antibiotics can indeed lower PSA levels if there is an underlying bacterial infection causing prostatitis. However, they do not affect PSA levels related to prostate cancer or other non-infectious conditions. It is essential to interpret PSA test results carefully and consult with a healthcare professional for appropriate management of prostate health. Always seek personalized medical advice for your specific situation.